I think that really highlights a stark contrast between vaccinations and supplements, whereas like the vaccines are very heavily tested, we know what's in them, whereas supplements are pretty much a Wild West. And
Yeah.
our HHS Secretary, RFK Jr., during his confirmation hearings, very famously is a proponent of supplements over vaccinations, specifically recommending vitamin A and cod liver oil in response to the current measles outbreak in Texas.
Yes.
Yes. I know that AMCNO recently released a statement on the confirmation of RFK Jr. If Jen, you want to briefly summarize what that is and what we're doing as like a physician professional organization to help, I guess, manage some of the new rhetoric of the current
Yeah,
administration.
absolutely. So I think when we think about health policy, we often immediately think to the legislative branch. So we think about Congress or we think about our state houses. And obviously, a good amount of health policy does occur there. But the most health policy that happens in the United States happens within the Department of Health and Human Services. So we are talking about the largest epicenter of healthcare policy, of public health policy for the nation. And so when we think about putting somebody in charge of that agency who has no medical training, who has no public health training, that's incredibly dangerous. And I know for the leadership of our group, we felt strongly that we needed to speak out. There are certain times when, even if something can be perceived as political, it's still the right thing to do. And I think, the significant downstream impacts that we're going to see by having this individual running the agency are going to be felt for generations. And I'm glad that we stood out against it. We're very concerned about his anti-vaccine views, of course, but just in general, his lack of education and training in this field, for him now to be seen sort of as the expert in the country is quite frightening.